So my goal here today is to understand how Phoebe's stated commitments translate into measurable outcomes for Albany residents. So with that in mind, and thinking about what you just shared about Morehouse School of Medicine, you highlighted, or Phoebe highlighted, workforce investments in its response. What is the retention rate for local nursing graduates, or the goal or plan to retain those nurses? And how does compensation compare to regional averages?
Yep, thank you for that. So what I can tell you about our retention rates, I don't necessarily know it by local graduates of programs, but what I do know is our nursing turnover last year was about 18% overall. That sounds like a lot, but the national rate is in the mid-20s. So we have lower nursing turnover than the national rates. And you know, that's taken us a while to do that. We have had to increase the number of staff that we have on the floor. Our ratios of patients to nurses, patients to CNAs on our medical surgical floors, we've had to increase to improve that. We've given market adjustments or increases in compensation. In the last 5 years, we've raised it $55 million to all of our team. You know, our minimum wage at Phoebe is $15 an hour. There isn't a single employee not making $15 an hour. The state minimum wage is $7.25. You know, that's what we're legally obligated to do. So, I think when we make those investments, we have benefits. We have 401, 403Bs. If we were for-profit, we call it 401k. We fund those. We have funded them every year since I've been here. And as far back as we go, we provide incentive plans to all of our team members, exercise facilities, subsidized childcare, subsidized prescriptions. We pay 85% of their medical and dental costs, when the national average is in the 70s. So I think our benefits and what we offer are as good as I've ever seen. And our turnover rate for our nurses is better than national averages.
Is that the goal? What is our goal for our community when it comes to retention? And is there a plan in place?
So I mean, I think any goal would be zero, right? But the reality is a nurse can get a job tomorrow, anywhere they want, right? In another community, down the street. And so that can be a challenge. Some people, they see, we're just getting ready to roll out. We just did a whole market analysis for all of our nurses. And we are, looks like in South Georgia, we'll be, if not number one or two in the highest paid from a nursing standpoint. It is hard to get that data because hospitals just don't say, hey, here's how much we're paying our nurse, because so they hold that confidential, but we believe we'll be number one or two from a nurse standpoint. Our goal is, of course, to not have any turnover. Turnover is expensive, but sometimes you have to have turnover, right? Because sometimes it's just not a fit. Sometimes people become nurses and they shouldn't have become nurses. Right? I imagine you all met some people like that. Some of you might be educators and you think you have teachers that maybe shouldn't have been teachers, right? And so turnover is going to be inevitable. I'd love to tell you our goal is zero. Our goal is to be better than the national average. And we'd like to get in the top quartile, and then our goal after that is the top decile in performance.